guys! So this video is going to be about things that you may not expect that x-ray techs have to do or have to know how to do. It's well known that x-ray techs take x-rays, but that is definitely not the only thing that we do. I think that sometimes x-ray techs are looked down upon because they think that it's an easy job. All you do is take pictures all day. That is not the case. And you would be surprised how difficult it is to actually take some pictures of certain patients, like especially in like the hospital setting where people are bedridden and they can't move themselves. You have to be really strong and able to move them and get them into the right position to take the picture. Or if people are really injured, you have to think outside the box. I hope that this video helps you guys to like actually understand more of what the job is like. If you were to be an x-ray tech in a hospital, the job description would be very different than if you were an x-ray tech at an outpatient imaging center or like an urgent care clinic. You have to definitely have a strong stomach and you have to deal with awful smells sometimes. You need to be able to see blood and be able to like deal with it. There are times when people break their bones and their bones are going to be sticking out, or it's going to be really deformed and it's going to look really gross. You can't be afraid of that. You have to suck it up and be able to take the picture. The very first patient on the very first day of my clinical rotations in a real hospital, the patient had fallen. I don't really think that's truly the case. I don't know, but basically, you know how when your foot is supposed to be like this when you're laying down? Well, her bone, or I don't know, something happened where her foot got twisted around and was flopped flopped over, hanging off of the bed, and her bone was sticking out. So it was like the tibia and the fibula were sticking out, and it was bloody and it was kind of gross, and I was just like, oh my goodness gracious. We ended up not needing to take a picture of that. They ended up putting everything back into the joint because the joint was dislocated and the bone was sticking out. We only needed to x-ray once they did that and once it was all wrapped up. But that was an experience. X-ray, it's a stressful job. It definitely is really stressful, but it's really interesting. And you can't get grossed out by all the gross stuff that happens. You just have to kind of think it's cool. Like that's how I make it through the days that are really hard. Just think of the things that happen as really exciting and interesting instead of gross and gory and ew, nasty. But I've had some crazy stories in the urgent care. I guess I could tell you guys. If you guys really like this video, I guess I might make another video about all the crazy things, the most interesting, insane situations that patients have come in to the clinic, into the urgent care clinic that I work at, or into the hospital. Most people think that x-ray techs just do these little stationary x-rays. That is not the case. Another part of an x-ray tech's job is to work with fluoroscopy, which is a type of medical imaging that shows a continuous x-ray image, basically like a movie on a monitor, just like a movie. So these procedures are used to see what's going on in your body in real time, and it usually requires the use of contrast, which is either barium or gastrographin in the case of being an x-ray tech. Barium is this white chalky substance that they put into a liquid form. They can make it really runny and really thin, or they can make it really thick. And then there's also gastrographin, which is really nasty stuff, but it's made of iodine, and iodine tastes really nasty. Whenever the radiologist is in there doing the procedure, the rad tech, the x-ray tech, what I am, we will help the radiologist in whatever they need us to do. Examples of the types of exams that we have to do are the modified barium swallow study, the esophagograms, upper GIs, small bowel studies, barium enemas, cystograms, hysterosalpingograms, I don't know if I'm even saying that right, lumbar punctures, myelograms, stuff like that. So basically with these exams, the contrast goes wherever it's needed to. So sometimes the contrast has to be injected into the patient's veins, or up the patient's urethra, or the patient has to swallow it. So the small bowel follow through is the longest one, where they have to take the contrast by mouth, and we have to take pictures every 15 minutes or every 30 minutes or every hour to see how far it goes along, and the radiologist will be able to see if there's like anything wrong in the intestines. So a modified barium swallow study is usually done with speech therapists and the radiologist, and then the x-ray tech is behind the scenes like working on everything. It's the speech therapist who gives the patient different consistencies of barium, so like thick, thin, like honey consistencies of barium, and we're x-raying their throat to see if their swallowing is functioning correctly. And if not, you can actually see it go into their windpipe. There's a esophagram that you get to see the entire esophagus to see what's going on. Those you're able to detect like cancer if the esophagus is actually doing what it's supposed to and going all the way down. There's barium enemas, where you have to put barium up the patient's behind. The barium coats the entire large intestine, and then you're able to see any polyps. And then there's also cystograms, where you shoot up contrast up into the patient's urethra, and you can see the urinary bladder. And then hysterosalpingograms, and I'm not even sure if I'm saying that correctly, but basically they shoot it up into your vagina, into the uterus, and then out the fallopian tubes, and then it just kind of like, once it comes out the fallopian tubes, and if it gets into the pelvic cavity, then that means that you're good. If it doesn't, then that means that there's a blockage and something is wrong. And then there's lumbar punctures. And then there's myelograms, which is where you, it's basically a lumbar puncture, but instead of taking stuff out, you're putting contrast in. And then the contrast goes into your cerebral spinal fluid area, so that they can get imaging. Usually after that, the patient goes to, I think it's either CT or MRI or both. Working with contrast like this, with every orifice that you put the contrast in, stuff can come out. So so you have to deal with vomit and urine and diarrhea or poop or anything like that. So you have to be okay with dealing with that. Okay, another thing, really, really important thing that x-ray techs do, but people don't seem to know that much, I don't think I knew about it until I got into x-ray tech school, was x-ray techs help in surgeries. There's this x-ray machine called a C-arm. It's basically a really cool portable x-ray machine. The reason why it's called a C-arm is because it is actually shaped like a C. Basically, the x-ray source and the x-ray detector are connected to one another, which makes it possible to take pictures at different angles in a sterile field. Especially with surgeries, you have to be able to stand the sight of blood and bones and muscles and guts, and it is kind of insane. The different types of surgeries that we help with are orthopedic surgeries, where it's like somebody broke a bone and the orthopedic surgeon has to put screws and stuff to stabilize it. There's also joint replacement surgeries, which are really, really gruesome. They're really, really barbaric. So basically they use drills and instruments that look like a hammer and a chisel to hammer in to the hollow of the bone. I think it's called the medullary cavity of the bone, and insert a different part. And it's a very gruesome thing. If you guys are really, really, really into learning about medical stuff, which I'm guessing you are because you're watching this video, you should watch some videos on the different surgeries. They're really, really interesting. There's also cholecystectomies that we help with. So basically that's a gallbladder removal surgery. Basically for a gallbladder surgery, they once the surgeon's in the abdomen, the surgeon adds the dye, and then you take a picture to see what's happening, and it's you're able to see gallstones if there's any. There's also cystos. Cystos are definitely my very favorite. So cystos are where you go, where the surgeon injects the the contrast dye into the bladder and up into the kidneys, and it helps them know where they are. And we take pictures, and it's really, really cool because while they're up in the kidneys, they're zapping any kind of kidney stones with a little laser thing. And then they're collecting it with like a basket and bringing it, and then you can see all of the kidney stones at the very end of the surgery. They usually put it in a little container thing and they send it to the lab to see what the kidney stones are made of. That was my very favorite. Another thing that I didn't really realize an X-ray tech did was like venipuncture. When you work at an urgent care, you do a lot of blood draws to send the blood to the lab. I think in certain hospitals, if they do a certain exam where you have to inject contrast dye into a patient's veins, the X-ray tech has to do that. So when I was a student, I never had to do that. I think that you might have to do that in certain hospitals. We learned how to do, like, we had a venipuncture lab in school, so I did know how to do it. I had to actually like practice when I was at my job at the urgent care because I forgot how to do that because we only had like one lesson in school. So it was like really, it was scary, but honestly, blood draws are like really, really fun. They're like one of my favorite parts of the job. You are more likely to have to draw blood if you work in an urgent care setting than at a hospital setting, but you might have to be able to do IVs in a hospital setting or outpatient setting where you have to inject the intravenous contrast. And then another thing that we had to learn in school, but that I never actually had to do, was being able to like catheterize a patient, and that I mean being able to put a catheter into a patient, into their bladder basically. You had to learn how to do it in school. You had to learn the steps and like the procedures that you're supposed to do. But I never really had to do that. So yeah, if you are afraid of doing that, just try to get a job that doesn't require that. And then I guess another thing, if you're an X-ray tech and you get a job in an urgent care, you have to know, basically if you don't know before you graduate from school, you have to learn on the job how to give shots, do EKGs, swab for COVID, flu, or strep, and also do like breathing treatments with a nebulizer. Thank you guys for watching. I hope that this video didn't scare you guys from being interested in being an X-ray tech, but hopefully it like enticed your interest, because when you work in the medical field, you kind of have to be a little bit crazy. Maybe not psychopathic crazy, but like, I don't know, instead of getting grossed out with gross things, you get really interested and it intrigues you. So yeah, hopefully this kind of intrigued you guys. I hope that you are all doing well. Thank you guys for watching.